everyone, I'm Dr. Rahul Rao from Mangalore Psychiatry Center. Today is our third episode, and over the last two videos I was behind the scenes. Today I'll be talking to you about reducing the stigma and increasing the awareness in psychiatry. So let me briefly tell you why I chose this particular topic. In fact, I wanted this topic to be the first. However, considering the ongoing increased levels of anxiety, depression, and insomnia secondary to COVID-19 situation, we thought those two topics would be much relevant to start with. Anyways, let's get to today's topic. So the reason I chose this particular topic is that studies have predicted that by the end of 2020, depression is going to be one of the most common leading causes of morbidity worldwide. And would you believe if I told you that just in the last 6 weeks, there has been a 40% rise in the number of cases related to psychiatry. So just before we start with the facts and the other important things about today's topic, let me just brief you up about what is psychiatry, who's a psychiatrist, what's the difference between a psychiatrist and a psychologist, and there's a lot of stigma that is attached to this particular branch of medicine, and usually that kind of stigma and misunderstandings happen when a person does not know exactly what a particular field is about and what a psychiatrist does. So I thought that it's better to go with basics, and that's why let me first tell you. Psychiatry is a branch of medicine which deals with prevention, treatment, and diagnosis of disorders of the mind. So how does one become a psychiatrist? So a psychiatrist is a doctor, so that means he finishes his 5.5 years of MBBS undergraduate course. After MBBS, he or she is supposed to have a postgraduate degree, that is an MD or a DNB in psychiatry. So then, who's a psychologist? Psychologist is not a doctor, no offense. So unlike psychiatrists, psychologists cannot prescribe drugs. However, they have a basic degree, that is a BA in psychology and MA or MSc in psychology, and they also have PhD courses in clinical psychology. So basically, a psychologist works together with a psychiatrist and helps us, in therapies and assessments like IQ assessment or SLD and certain other assessments that are required in our routine practice. Psychiatry is a very young branch of medicine. Until 1950s, believe me, there was no particular drug to cure or to alleviate symptoms of the mind. Yes, I'm talking about the first drug that was invented in the early 1950s, that is chlorpromazine. So then how would the psychiatrists treat people prior to that? How would the society look towards people with mental illness? Yes, prior to 1950s, the society would again attribute these behavioral changes to bad omen or any spirit that is residing inside a person, and also they would attribute it to evil deeds. I'm talking about practices such as shock therapy, creating a hole in the skull so that the evil or the demon would escape, and certain other practices such as chaining, and these patients would be kept in religious institutions. And there's also a famous painting from the early 15th century called as the Ship of Fools, where a set of patients with mental disturbance, with psychiatric problems, were on board of a ship, and they would just let the ship sail across the sea. And this was basically how it was in the previous era. It's quite unfortunate that this is the 21st century, and even now, even till this date, people attribute psychiatric illnesses to the evil deeds, to black magic, possession, etc. In this video, I would also like to share with you guys some of the common myths about psychiatry. For example, in local lingo, if somebody has some deviances from the usual norm, and the people would say that oh, I mental mara, I psych mara. These are the common terminologies that people use. Let me tell you that all conditions in psychiatry are not psych or psychotic. There are various other conditions in psychiatry. Psychiatrist also treats depression, anxiety, insomnia, adjustment disorder. I'm talking about certain changes in your life which would kind of put you on hold and preventing you from carrying out your day-to-day activities. It can be as simple as having uh, anger issues, anger management, or substance abuse as well. Psychiatrist also treats sexual dysfunction and disorders pertaining to sexual cycle. Now, the second most common myth that I come across is once a patient is always a patient. Please, please, please pay attention. It is not the case. Psychiatrists are not godmen or pseudo babas who brainwash your mind and to get things done from you, to make money out of you. No, we are not, definitely, we do not have that intention. We treat a particular patient after having studied their course profile, their disease profile, and whatever the medications, the duration of medications, or the type of medications we choose, it all has a scientific basis. We would not want a particular patient to be on lifelong medications and unnecessarily. So, the third common myth that we come across is psychiatric medications are all addictive. Well, whenever my patient asks me this question, I politely tell them, I have been trained in psychiatry to get you out of addiction, not to put you into addiction. So you have to understand that these medications are just like that of diabetes or hypertension. Yes, some patients do need to take them for a long course of time, maybe till they die. But that doesn't mean that these medications are going to cause you harm to a great extent. In fact, I would like to put it this way. If this particular patient was on these medications, his quality of life would definitely be much, much better. And hence it is required for that patient to be on these medications for a long duration and long period of time. Fourth common myth is that psychiatric conditions are genetic/hereditary. Well, this is not totally a myth. I do agree that some conditions in psychiatry are genetically predisposed. However, there are certain other conditions arising mainly out of stress or day-to-day activities which need not be genetic in pattern. In a stressful world like ours, I'm sure that any person in that particular place or that particular lifestyle would develop psychiatric conditions. I'm talking about depression, anxiety, or panic attacks. Well, I'm sure there are a lot of myths pertaining to this particular branch of medicine, and I'd be happy to answer your questions. Please watch the video, like, share, and comment, and subscribe to my channel. If you have any queries, do feel free to contact. I hope you're all doing well both mentally and physically. If in case you need help, please don't shy out. Psychiatry is just another branch of medicine. Feel free to contact any psychiatrist around you. And if you want that psychiatrist to be me, then please check the description for appointments. I hope you like this video. If you really do, then please leave a comment. Thanks for watching. Stay home, stay safe. Mental health for all.